In terms of women's health, so women, be they lesbian or bisexual, in terms of breast cancer, ovarian, and endometrial cancer, some data, but not all, has shown that there may be an increased risk for women who have sex with women. Any reason why that would be? Does anyone know why women in general? What are risk factors for women in general for breast cancer?
Maybe not having children.
Okay, so not having children. Okay, obesity. Okay, lesbians have been shown to have higher rates of obesity than their heterosexual peers. So theoretically, they may be at increased risk for breast cancer. Nulliparity, or not having children, is a risk factor for breast cancer and ovarian and endometrial cancer. And lesbians have historically been nulliparous. So the increased risk is theoretical. In terms of cervical cancer, data has shown that women who have sex with women aren't obtaining pap smears at rates similar to their heterosexual peers. And the idea behind that is that the false assumption that having sex with women, you are not going to come into contact with HPV and develop cervical cancer. Whereas a lot of data have shown that even women that identify as lesbian have had sex with the man in the past, and it's not the only way to transmit HPV. HPV can be transmitted via sex toys or digital contact. Okay, it's basically any skin-to-skin contact or sex toys. So the notion that you have to have sex with a man to be at risk for cervical cancer is false. Also keep in mind sexually transmitted infections. Nutrition I kind of highlighted with the statistic on obesity within the lesbian community. So just be aware with your patients to always review diet and exercise. Any questions about that? All right, what about men's health? So I'm surprised no one mentioned HIV. I don't know, maybe it was the elephant in the room. People feel like they didn't have to mention it, but still HIV remains a huge health concern for men who have sex with men, be either gay or bisexual. It disproportionately impacts communities of color. So Black and Latino men who have sex with men are disproportionately becoming infected with HIV. Vaccinations, so you want to vaccinate all your patients against hepatitis B. You can't vaccinate against hepatitis C, but you should screen for hepatitis C. Hepatitis A for men who have sex with men, because hepatitis A is transmitted fecally and orally. And then HPV vaccine. Do people know much about the HPV vaccine? And this is for men and women. What are we trying to prevent with the HPV vaccine? Okay. And theoretically, HPV can cause cancers in the head and neck or pharyngeal head and neck cancers. It's also responsible for anal cancer. Classically, when they studied it, they looked at cervical cancer. And I think going forward, they're going to see if vaccination impacts head and neck cancers and anal cancer. And then in terms of eating disorders, statistics have shown that gay men are at higher risk for anorexia and bulimia eating disorders than their heterosexual peers. So just something to keep in mind with your patients. Okay, what about transgender health? Does anyone know who this is a picture of? Who is she? Okay, she's on Orange is the New Black. And who's even more kind of famous now? Right, Caitlyn Jenner. Okay, so transgender individuals are becoming, bigger in the media. There's like a spotlight being shined on them right now. And I don't think we've heard much about their health concerns. I think, for the majority of the population, there's kind of this like voyeuristic interest in transitioning and what that entails, right? Is someone going to medically transition, taking hormones? So in terms of hormones, if it's a male to female transition, they'd be taking estrogen plus minus progesterone. If it's a female to male transition, they'll be taking testosterone, right? Any classic major side effects people know of by taking any of these hormones in inappropriate doses? Take too much of it, testosterone, what could happen? What do you think if you took too much testosterone? Oh, yeah, maybe hair loss. Yeah, hair loss. Acne, mood disorders, and that can go for both hormones. Mood disorders, acne, maybe hypertension, testosterone. I'm sorry, not hypertension, dyslipidemia was the one. Alterations in your cholesterol. And then for too much estrogen, what can happen if you take too much estrogen? I'm sorry? Bone loss? No, if anything, I think it would help. Blood clots is the classic one. It's the development of blood clots. So it'll be like a clot in your leg or a clot in your lung. So even women that are on oral contraceptives, if they come in like they can't breathe, they're having chest pain, you're like, oh, they're at increased risk for a blood clot being on hormonal supplements. Just something to keep in mind. And then in terms of surgical transitioning, so just to keep in mind, if you meet a patient who has undergone surgical transitioning, if they transition from a male to a female, the prostate is not removed. So you would want to perform age-appropriate prostate cancer screening. And for female to male, the cervix is not removed. So there have been cases of women that have transitioned to men and subsequently died of cervical cancer because no one thought to screen them. And then in terms of breast cancer screening, if they have their breasts reduced or removed, depending on what procedure they had, there may be still some breast tissue, so you may need to perform an ultrasound to just assess if they're, obviously if they're complaining about a growth or a mass, you're going to pursue it more aggressively, but it's always just something to keep in mind and assess with your patient. In terms of violence prevention, so transgender individuals are statistically increased risk of violence via hate crimes. Keep that in mind. And then in terms of sexually transmitted infections, some transgender individuals work as sex workers as a primary source of income or as a supplementary source of income. So just be aware to assess them for STI risk and treat appropriately. What about for kids and adolescents? So similar issues, you want to assess and treat for sexually transmitted infections, HIV. Kids are increased risk of suicide and depression if they identify as LGBT. You want to always assess risk of substance abuse. Among children that are homeless, LGBT individuals are disproportionately represented in that group. A lot of kids are kicked out of their homes or shunned by their families and subsequently become homeless. Keep that in mind. And again, going along with, as we mentioned, harassment and violence, you also want to assess with all your child and adolescent patients whether they feel safe, be it at home, their community, school. And this is just a picture of GLSEN. Has anyone ever heard of GLSEN? Gay Straight Alliance. They have them at schools across the country. Just a means of support, kind of like a safe zone for students across the country. What about as we get older? What are some issues for all of us as we get older? Who's going to take care of us, right? So historically, gay and lesbian individuals, maybe some transgender individuals have not had children of their own. And as we usually see, when an elderly person becomes sick, a lot of times the people that step up to care for them are their children or close members of their family. And for a lot of members of the LGBT community, they may not have that. And as a result, they may not do as well, right? If they don't have anyone looking out for them. So these individuals may be in greater need of support from their case managers, their social workers, from the healthcare system. So keep them in mind. And then where they may end up, if they end up in a nursing home or an assisted living facility, are these people that are caring for them going to be welcoming and provide quality care to them. Just something to think about and keep in mind. Another thing, hormone use among transgender people. We don't really know what are the long-term side effects of being on hormones. So for someone that's been on hormones for 20, 30, 40 years, what are the long-term health risks that are posed by this? If testosterone increases your cholesterol level, these individuals may be increased for heart disease, right, earlier than a cisgender individual, right? So just something to think about. And that's research that's still hasn't been done yet.